Well, hi everybody, Lisa Tamati here from Pushing the Limits, and welcome back to the show. It's great to have you with us. Before we get underway with today's guests, I just want to remind you that if you want to reach out to me, you can do that at lisa@lisatamati.co.nz or hit me up on Instagram. I'm really active on there, at Lisa Tamati, Facebook, of course, YouTube, and head over to our website, lisatamati.com, and check out all our programs. We'd love to help you out. Now, before we go, we're having a really a bit of a tutorial today. We've got a guest whose podcast I was on recently and who is returning the favour by being on mine. So we have a physiotherapist who is an expert in running, and he's going to be talking to us about the most common running injuries and what we can do with them. So welcome to the show, Brodie Sharpe. Nice to have you.
Yeah, it's good to be here, Lisa. Good morning.
Yeah, awesome, Brodie. So, Brodie, you're in Melbourne.
Indeed.
What's the weather like over there?
Pardon?
What's the weather like over there?
Oh, God. It's pretty miserable at the moment. We had little specks of sunshine this weekend, but most of the time it's raining and cloudy and pretty cold. Not
so good. So I just do the wrong Brodie because I had in my head another lady. So sorry, Brodie Sharpe we've got on the show. Sorry for that faux pas. So, Brodie, we're going to talk about some of the most common injuries and what we can do about them and what your take is on them. But before we get underway, now you have a podcast. So tell everybody about your podcast, what it's about, and why the heck they should listen to your show.
Yeah, absolutely. So it's called the Everyday Running Legends podcast. Yep. And I started it about just over a year ago. And did it because I love hearing running stories, and I love that, like seeing in my clinic, runners love talking about running. And being a huge podcast fan myself, I was just listening to all these running podcasts and just really wanted to get involved, and noticed that I didn't want there to be just a podcast where I was interviewing the experts, because that's your role. That's you guys and all the other podcasts I've been listening to. And I just wanted to find just everyday runners, and just if they had a really cool running story, just to share that and try and spark some motivation in people, because, you know, those certain types, unlike yourself, there's other people that do need a bit of like external motivation to, you know, listen to stories and, just get that spark just from everyday runners. And if someone's just starting to run and seeing that there is like someone just like them and they're training for a marathon as well, it's like, oh, maybe I can do that too. But in terms of the guests, the variety of the guests I have, they do get quite, they are quite expert, some of them, but it's pretty much on a wide spectrum of the people that I interview. Some people doing their first 5K, whereas someone's just finished an ultra or finished doing like 100 marathons in 100 days. So it's a wide variety.
So right across the board, but all about inspiring and empowering other runners to have a go and to step up and take on big goals by the sound of it.
Yeah, it's less about like tips and tricks and more just like, how are you battling mentally? Like, what's the stuff you're going through? What do you do for motivation? And yeah, obviously just a really cool story along the way.
Awesome. So it's people helping people. That's really awesome. And you're a physiotherapist. How long you've been practicing physiotherapy for?
So this is my 7th year as a physio, and I'm working at a private practice. And one of the other aspects of realizing, working out that runners are the ones that give me passion, because I wasn't a runner when I first started as a physio. I've been running for about 4 or 5 years. And as soon as I started running, seeing other runners in the clinic just give me a lot of passion. Yeah. And that's when that sort of spark went off in my mind, thinking like, oh, maybe this is what I should do with my life. Maybe I should just incorporate running in a lot more facets within my life.
Well, we certainly need more physios who know what the heck they're doing when it comes to running stories, I can tell you. And I know that you've got because we've talked offline, a dream to one day have an online membership site or some sort of thing online where you'll be able to deliver your physiotherapy, but you're not quite there yet, but you do already have a website. You're running some actual classes in Melbourne. Obviously, most of my listeners will be not in Melbourne, but if you are, then you can check out your classes. So tell us a little bit about your website, your blog, where they can find you there.
Yeah, cool. So the last couple of months, I've realized that I eventually want to open up my own physio clinic with a running niche, and taking small steps at the moment. I've opened up my own little side business called the Breakthrough Running Clinic. And at the moment, all it's doing is opening up 2 or 3 classes a week at the moment, just doing like fitness circuit classes for an hour, tailored to increasing your running performance and decreasing your risk of injury. And that's going to be like a stepping stone into, obviously, once it gets big enough, opening up my own clinic and just realizing when I need to detach from my current job and just like start working on that.
Yeah, like we all do, sort of start with a side hustle and then hopefully move into mainstream. You bring up a point. So you're doing classes that are all fitness class based, but with the purpose of improving your running skills. So you obviously have a bit of a similar philosophy to me. Running isn't just about collecting kilometers, is it?
Absolutely not. No. And I feel like there's always this type of population of runners that are like, oh, I know strengthening will really help me. Oh, I know strengthening will, decrease my risk of injury, but they just never do it. As soon as they're feeling okay, and as soon as once they're injured, they're just like, oh yeah, okay, now I should start doing all my strengthening. Now I should start doing my rehab. And then once they're better and once they're in a good flow, all that strengthening, all that work that they've done just drops off until they're injured again.
It's so true. And because we all like to, make sure I'm at my run or my Strava accounts, just collecting kilometers and looking really good. And nobody gives you brownie points for doing some workouts in the gym or some body weight workouts. And you can't see it, but man, it is such an integral part of being able to run injury free, isn't it? To do run specific strength workouts. So we're not saying going and lifting massive weights, are we? So what type of things do you teach in regards to strength?
Yeah, cool. So there's several things that we could do. Strengthening the hips is huge. Like the glutes are probably one of the most important muscles when it comes to running. And so a lot of my classes are tailored to just smashing out the glutes. Calf work, heaps of calf work. There's a lot of work. You know how people do your standing straight leg calf raises and just do a bunch of those.
Yep.
A lot of that time you're working your gastrocnemius, which is like the muscle on the outside of the calf, and they rarely focus on the soleus, which is like deeper to that gastrocs. And when it comes to the research at different speeds of running, your soleus works like between 6 to 8 times your body weight. Whereas the gastrocs on the outside is only 2 to 3 times your body weight, which you're predominantly using when you have that straight leg calf raise. And for runners mainly, you rarely have this really straight leg when you're running. Yeah. It's usually bent, which recruits more of that soleus. And so it's just using those type of exercises to
so what's one, can you explain, 1 or 2 exercises? Because that's news to me. Soleus, or the soleus, I think we call it, how you would actually, initiate that sort of movement to strengthen that? Yeah,
perfect. So you can, the easiest way is like you recruit your soleus when your knee's bent.
Yes.
And you're still doing your calf raises. So a nice easy one is to sit down and you put a nice heavy dumbbell right on like your thigh towards your knee. And then you just start doing calf raises just in sitting. And you can do, if you want to get nice and heavy, it's really like uncomfortable to have something so heavy on your thigh. You can get like a bar and just a towel in between like your knees and the bar and just bring it across the knees and then start doing calf raises. And you try and go quite heavy. The other way to do it is kind of just like as you would normal calf raises, in standing, but just unlock your knees and just hold on to a bunch of weight and start doing calf raises. But a lot of people get into it's really awkward to do unless you're, because you need to keep your knees bent and you still need to be driving upwards. And so it's kind of hard to coordinate if you haven't had that practice. So a lot of people just start with sitting.
Yeah, the sitting one, at least when you've got access to a gym, that would be, an easier option. All right, I'm going to learn something already. I'm going to put that into my Because anything that can strengthen the calf, of course, that's where your propulsion, or part of where your propulsion comes from, is being able to push off strongly with your calf. So that would increase that. And
absolutely
go heavier with that, because you are wanting to build strength rather than endurance in that sense.
Absolutely correct. And I kind of digress a little bit. So back to the classes. The classes, I also focus on a bit of cardio, so a lot of skipping and stuff, a lot of plyometrics. So we do like drop squat jumps. And so you drop from a height, you land, you squat, and then you just quickly push off and land onto a higher sort of box. We do like these sort of rocket jumps, like a lot of plyometric stuff as well as strength. And always at the end of our classes, we do 10 minutes of stretching, just to open up the hips, open up the spine. Like your upper back, needs a lot of extension and rotation when it comes to running. And so all of our classes tailor to stretching.
Wow, that's actually another really good point. The upper body is something that runners think, well, my upper body doesn't need to do absolutely anything except swing my arms a little bit.
Yeah.
Who is it?
Yeah. And there's a lot of interesting research when it comes to the importance of stretching, because before, during, after running, stretching isn't that vital, but there is research to show if you do 2 or 3 stretching sessions outside of your running days, then it can be quite beneficial.
Absolutely. And with one caveat, like you say, like don't necessarily do like static stretching is a definite no-no before going for a run, isn't it?
Mm-hmm. Yeah, absolutely. And yeah, I say static stretching because that's what most people like refer to, but dynamic stretching can be really good just before running.
Yeah.
So just increasing your body temperature, getting those high knees, getting those butt flicks and leg swings, all that sort of stuff can be really good before a run.
Man, this is all super. This is gold. This is really gold for everybody, I think. And in regards to the upper body, like I've found in my my early career, I just ran. I never did any strength training. I didn't know what the hell I was doing. I was just running. And as we all started off, not knowing what we were doing. And I had a very weak, flaccid upper body, if you like. And I was very much after, running ultras, you'd be bent forward, you'd be sort of, bent over at the waist. Your digestion would go, the swings of your arm would go. You'd end up, and like your whole form collapses when your upper body is strong enough. So I'm really big on actually building up a little bit of back strength, like to be able to hold your shoulders back, to keep your chest nice and high and forward. What's your take on that? How important?
Yeah, so I guess it's just holding like form. Like I don't think at the moment I'm tailoring it to like endurance, like ultra marathon type of distances. Yeah. I do have a lot of side planks. And are you familiar with like Russian twists? Those sort of.
Yep.
My mum attends my classes sometimes and she hates the Russian twists, and they're almost in every week. And so just holding onto a medicine ball, like sitting on the floor and then just leaning back and doing some rotations, making sure that the lower back is in a slight arch, because that's the kind of form that you will be in when it comes to running, and just trying to train the endurance. So make sure it's not too heavy that you're really fatigued after 5 to 10. So make sure it's still heavy, but light enough that you can push out maybe 20 to 30 reps and just train that endurance. And then you have side planks, which everyone's kind of familiar with side planks, but if you wanted to tailor it to runners, grab a really small weight, like 1 kilo, 2 kilo, and just start doing some rotations. So tap the weight on the floor, keeping a straight arm, and then just raise it up to the ceiling and open up the upper chest. And just that's what the muscles you need to train. That's the position you need to be in when it comes to running. So
really it's
kind of like a mobility, but also a strength, endurance kind of exercise.
Yep, that's great. I mean, I do a lot of side planks, but I'll add in that little weight. That's a really good tip. And that's really important also for your breathing, because once you collapse in the middle, of course, your breathing goes, your lungs aren't fully inflated or able to be inflated. So that's a really important thing. What about the core?
What about the core? Yeah. So it all kind of works as a whole unit.
Yeah.
Like I I rarely use like core exercises in isolation when it comes to throwing a runner into some strengthening exercises. But like I said just before, if you're an endurance athlete, you need to make sure that you're training the endurance for your core. So doing your planks and things, but make sure it's not heavy and you're doing like low reps. Make sure it's light enough that you can push out 20 or 30 and really feel the burn after about 20 or 30, because the core needs to be stable, but also needs to get you through that endurance event. So like you were saying with your race, as soon as it gets towards the end of an endurance race and you start dropping your posture, and it's the endurance that you need rather than the strength to last throughout that whole entire distance.
So whereas with calf muscles, you're suggesting going a little bit heavier because we're trying to build strength in that muscle. But like core, I mean, it depends on the distance you're running, I'd imagine.
Exactly.
If you're a 5K runner, then you probably need a whole lot more explosive strength than if you're running a 100-miler, would suggest.
And the thing is, because like with my classes, when I'm doing all these strengthening exercises, I have to kind of tailor for everyone, and I have to tailor for the ones who are just doing their Couch to 5K app and just starting out, compared to the person who is training for a marathon. And I've actually got someone who's training to do 7 marathons in 7 days. And I actually have people who are just starting and doing the Couch to 5K app. So they're all in my class. And why we do the strengthening for an endurance athlete is because you're raising up the muscles, its capacity. And so every muscle, every ligament has a certain load capacity. And why people get injured is like 80% of all those injuries out there for runners, they get injured because they've exceeded their load capacity in some part of the body. Right. And so any strengthening, any heavy sort of strengthening stuff raises that load capacity and makes it harder to get injured in a way. So it's harder for you to push beyond that load capacity to get an injury. Yes. Yep.
And the endurance side of it, so doing lighter weights, and so that's all about being able to maintain over a longer period of time that form and that. I know with in my case, I had a really bad back injury, and I still do. I've got 4 discs that are completely buggered. There's nothing left. And so I broke it when I was in my early 20s. And so for me, core work has just been absolutely vital. There was a time when I didn't do a lot of core work and I had a lot more pain. And I had, a time where I thought my whole career was over because of the bulging discs and the pressure on nerves and the horrific spasms and all the things that you get. And instead of going down the surgical route, I went and just absolutely hammered my core over a period of, a good year. And since then, touch wood, not a single pain, not a single spasm, even though, getting older and theoretically it's getting worse. It should be, that's how important I think core is, because it protects also your back. Can you comment on that?
Yeah. So like I said, we try, if you were to come into the clinic, we'd tailor our approach specifically to you. And with your back history, like with that type of kind of damage or that kind of experience that you've had, your back muscles will lack that strength and will lack that endurance. And there is a little bit of evidence to show that people that do have that, those sort of experiences and those conditions, the core probably isn't firing the way it should. And so even with that injury, it can waste a little bit of the back muscles, depending, because you've probably had a bit of rest, and the muscle firing probably isn't recruiting those muscles the way it should. And so we would tailor definitely a lot of core sort of exercises for you and training. There's little, like, we call multifidus muscles throughout the back, which are responsible for holding the spine in a good alignment when it comes to the lower back, and just smashing out those, getting them to fire, getting to work, build up strength and all that sort of stuff, just to really have a back that's built for running, and can really sustain those loads.
Because when I say core exercises, I mean that whole area, so like the whole your back, your lower, even your glutes, your hips. All that area really is part of that whole complex, isn't it?
Yeah, and then glutes as well, really strengthening glutes.
Yeah. So let's go into a couple of exercises that maybe you can explain that would be simple to explain, obviously, without a visual.
Yeah, absolutely.
Live. Give us a couple of glute exercises if you've got something.
Oh, I'm glad you asked this because I have a favorite. So they're called crab walks, if you've ever done crab walks.
Yes.
And so very prominent in my classes as well. If you have those TheraBands, like those stretchy elastic bands, and so you can I like to put them just above the knees. There's a bit of research around where you put the bands, whether it's around the foot, ankle, or knee, to recruit different kind of muscles, but I usually prefer around just above the knees because people can hold form a bit better. So really heavy bands, I like heavy bands, and what you want to do is put the band just above the knees and go into a bit of like a quarter squat. And so when you go into that quarter squat, you start walking sideways, and you try and make sure. It's always good to like do a demo because people just take a big step and then a big step back, so the feet kind of come together with their second step. But you really want to try and maintain that squat and keep really wide knees, really wide feet, and you're just doing really small steps, left foot, right foot, really small steps, and keeping the knees really far apart and keeping the feet really wide apart. And you're just separating the knees and putting a lot of tension on that band. And you really should start feeling the glutes firing if they're all working correctly. And you can progress that by doing those crab walks up on toes if you want to recruit a bit more calf and the knees bent. So we're working that soleus muscle, and that's got to be one of my favorites because you'll feel those glutes burn really quickly. And if you want to I usually try and get my clients to take about 20 steps. And for 20 steps, you should be only covering about maybe 3 meters. And so you're taking really small steps. So 20 steps up, 20 steps back, have a rest, hit the glutes a little bit, let that fatigue kind of recycle. And then 3-4 sets of those is really good.
Yeah, that's. I only managed about 10, and I'm like, it's already go back the other way. And push myself a bit harder. No, those things are really good. Actually, those TheraBands are absolutely fantastic for a number of in different ways, eh? And that one really gets on the outside, isn't it?
Absolutely. Yeah, you really should be feeling it. And then another good exercise I like to do is, because we're working sideways, but runners like to go, back and forth. So it's if we want to try and tailor for that plane, doing some like Bulgarian split squats, which are just like a lunge. If you can imagine a lunge, but your back foot is up on like a bench, and you're going down into a squat and then coming back up. So just working in that kind of plane really suits runners, and it can recruit a lot of hamstring, a lot of glute. And it's quite a tricky exercise. If you're finding it too easy, just hold on to some weights, and you should be really fatigued really quickly. And then that can trigger into like rocket jumps. If you put like one foot up onto a box and then you're pushing through that leg that's up on that box and like launching yourself into the air, that can like start to recruit a little bit more plyometric sort of power and strength. But using the same kind of muscles, but instead of doing this slow, heavy stuff, you're doing this like explosive movements.
That's really that's fantastic. So that's something I've always had trouble with is the explosive power. Obviously, being a long distance endurance athlete, you lose that explosive power, and it's something that I've been working quite hard on in the last couple of years, with mixed results. I probably need to come and see you and tweak because it's not been my area of specialty. What about box jumps? Is that a good thing to be doing?
Heaps, yeah. Love my box jumps. They're really cool.
What is the trick? Now, I spent bloody years trying to do those really high box jumps on the how you have the 3 different sizes on the box.
Yeah.
And I could never do the top one until about 3 weeks ago. And I just
congrats.
It's a big deal, the reason it's a big deal is like I just thought, well, I don't have that explosive power. I've never had it. I've trained it out of myself. I've got, I made all these reasons why in my head. And then I was watching again and again how people do it, and I realized suddenly, hang on, it's a technique thing partly. And it's a mind thing very much with the box jump, isn't it? And when you go into it, you have to jump. Like I still, when I go to the gym today to do one, I won't be able to go to the highest one straight away. I have to go down and work my way up so that I can get that mental ability that I can do it. And the first couple of times I'll go to jump and then I'll, and I won't be able to do it. So it's very much, it's a good metaphor for life, actually. So what are some tricks for that?
Oh, yeah. What are some tricks? So I guess just starting out small and just working on a really good technique. I like to make sure that when people launch off and land onto the box that they're doing it a bit quieter. Mm-hmm. So a soft takeoff and a really soft landing, not just doing this really hard thud. And it's really obvious as soon as they land on the box, if they're just they're smacking down on the box. Try and land a bit softer because we want to run quiet and we want to run soft as well. So just trying to do that as quietly as you can recruits a lot more, a better landing strategy with like the ankle calf component. But like you said, there is a bit of a technique to it. You use a lot of arms to really propel yourself. And it's just about like recruiting different muscles. So if you're doing a lot of skipping, if you're doing a lot of, if I mentioned that, that Bulgarian split squat where you're doing a lunge with the back foot on, if you were to go down into a lunge and then just try and take off in the air and try and lift your front foot, like, a couple of centimeters in the air and then land, it's just training a lot of this like recruitment, getting that power, because when runners start getting to their 30s, 40s, 50s, a lot of them just find a distance, find a speed that suits them and they just run at one distance. And the body gets used to that. The body doesn't get used to recruiting all these like power muscles, and they're just like sustaining that kind of like slow twitch muscle fibers. You really want to get a decent variety of recruitment through the muscles. So if you're not training a lot of like quick, like sort of explosive movements, you're not really going to adapt to those box jumps. And so I would say just trying to really recruit a lot of that sort of muscle fiber. So doing a lot of skipping is a good one, a nice easy one. You
can do that, me in my 50s. Is that possible after 30 years of doing the slow stuff? Because I have struggled with it in the last couple of years and I have made progress for sure. So I have, but still don't have seem to have that bounce that a 25-year-old would have,
Yeah, it's tough. And we're talking about intensity, and you do lose a bit of that intensity as you get older and as the muscles start to, stiffen up a little bit and they lose that recoil. Yes. But it can be strengthened. It can be retrained. You just have to take it really slowly. Yeah. But anyone can skip. Anyone can skip on like one foot. If you can't do that, you probably shouldn't be running. But then just try.
With skipping, just again from my experience and some of our athletes, if you go from zero to doing a lot of skipping, you can end up with troubles with your Achilles and people think like when they run, if I do a lot of running, I should be able to skip. But skipping's pretty intense. You're jumping up and down on one spot instead of like transitioning forward and going from right to left and kind of doing this like gradual fall and just catching yourself from falling. It's a lot different and it's a lot to propel you up. So only just skipping for like a minute or two to start off with, it can be quite profound and establish a lot of, or rebuild a lot of foundation. Don't skip for 10 minutes when you haven't skipped before, or you're going to end up in big trouble.
100%.
Yeah, so building it up. That's really good. So what about, let's move into foam rolling and myofascial release, mobility work. What's your take on all of that sort of good stuff?
What's my take? So each to their own when it comes to foam rolling. A lot of people love it or love to hate it, whatever angle you want to take on it, because it's never a really pleasant experience. I really like to use the foam roller. If I was to use the foam roller for all of my runners, it'd be on upper back mobility. So you can easily like place the foam roller on your upper back, across your upper back, and like arch backwards to create that extension. Or do a lot of rotations. So if you're in 4-point kneeling, and the foam roller is just like resting alongside you, just to get your opposite hand and put it on top of the foam roller, and then like push it forward. So you're actually rotating through your upper back. That can be implemented for every runner. And then when it comes to myofascial release and like calf release, all that sort of stuff, it would depend on the individual. It would, because not everyone needs it, but some people really need it. And that's when you have to look at someone's running biomechanics, and if they're really stiff in a particular area, then start doing some stretching, then start doing some foam rolling. Because I talk about the evidence when it comes to stretches. There are some populations who are really stiff, and the stiffness in the muscles is actually impacting their mobility when it comes to their running.
Yep.
And they're the ones that they really need a bit of stretching before a run, and they do need a bit of foam rolling and that sort of stuff.
Yeah, and they can benefit from it more than someone else. What about, your typical ITB band issues and rolling, so foam rolling, not just down the side of the ITB band, which is what everybody seems to do, but more crossways and across the front of the leg. What's your take on that one?
I don't use that a lot, to be honest. I do see a lot of people with ITB issues, and there's a pretty common running condition, which is Itb Friction Syndrome, and it's pretty much like pain on the outside of your knee when it comes to running. It's like a repetitive sort of stuff. So if you're doing like a lot of downhill runners tend to get it, but if you're just doing this repetitive same terrain sort of thing, if your I want to say technique or the load has changed, you see it with a lot of females because their hips are a bit wider, and if they contact their foot right underneath them, the angle of the hip kind of comes inwards and puts tension on that ITB, which can flick the bone just on the outside of the knee, and it just rubs consistently. And if you do like a long run, it could just rubs, and then ends up getting really sore. So I do see a lot of ITB issues. But what I find really effective is to calm it down by getting people to start running uphill and then walking on the downhill. So they're avoiding that downhill thump, and trying to, it's really hard to train someone, but someone who's an experienced runner is really in tuned, just getting to widen their stance a little bit. Because what the issue is with ITB issues, with the ITB friction syndrome, is that cutting in of the foot. So if you've got a wide hip and you're contacting your foot almost in the midline, and some people even cross the midline and contact on the other side, that tension on that ITB is a bit too excessive. So just training someone to widen their stance a little bit can really offload. Yeah. So it's hard to do.
Yeah, so you see girls with, got wider hips, maybe smaller waist, and then it tips inwards. So the knees are tipping inwards and they're not up scenario. Is that sort of what you're thinking?
Yeah, you can see it pretty obvious. Like if you just run, if you see, I say females because they're the most common that have this sort of presentation. But if you look at a female runner who isn't that strong through the hips, and they're contacting their foot like directly underneath their body, they have this angle of their knee that's just like, it really like cuts in, and it leaves them really prone to that type of issue, and patellofemoral pain as well, which we can talk about in a second. But so the real issue, we can change their training. Like I said, we can decrease their load, increase their hills, because they're not bringing their knee into they're not straightening out their knee when they're running uphill. So that can offload that ITB really well. And while that's calming down, really try and do a lot of strengthening through the glutes, because that will pull your knee back out and avoid that sort of collapsing in of your knee. And just training them to widen their stance a little bit, which as soon as I say that to people, if they're on the treadmill and I say, oh, can you widen your stance? They go way too far beyond what they should, and they're like sort of like running side to side, so they're just jumping side to side. But it really needs to be a difference of like 5 centimeters to make all the difference.
Wow, that's a really good one. So for the girls out there struggling with that and got perhaps slightly wider hips, that might be something to try out. Patella from what did you call it? Patellofemoral
pain.
That's the one.
Yeah. So that's probably the most common injury when it comes to running. And like I do talk about changing technique and increasing strengthening, but like I said last time, with all running injuries, 80% of all the running injuries out there are just an increase in load. Like someone's increased their load too much, and that started causing it to break down. So when I get someone into my clinic, we always go through, okay, what's your training been like? Have you increased? Are you training for a marathon? Are you training for a race? What increase in volume has there been? What increase in speed has there been? Have you changed your shoes? Have you changed the terrain? And we're trying to identify if there has been an increase in load, and then managing that. Because all we need to do is that, and say, okay, you've gone from 25 Ks a week to 45 Ks a week. Okay, let's have a week off and then just slowly get back into it and just slowly ramp up. That's sometimes all you need.
And that's why the structure of a good structure plan is really important, so that you don't come into that overload.
Yeah, and just while I digress a little bit, while we talk about increasing the load, if I get someone into my clinic who started getting knee pain, and we try and identify everything to do with their running, and try and identify an increase in load, if there's none of that, there might be something that decreases their capacity. So this is what gets ignored a lot of times, but sometimes a lack of quality sleep increases in stress and anxiety. Sometimes medications like anti-inflammation medications, and just like reducing the quality of, or like recovery, all that sort of stuff can actually reduce your load. And so you can do nothing else, and you can do no change in load, but just if you're anxious or if you've got increased stress at work, that can decrease your body's ability to recover, and you can start getting these overload injuries without doing any change in your training.
Yeah, we called the wellness checklist that we get people to check in with themselves every day before they go running, especially if they've got a big session coming up today or a hard one. And it checks off things like your hydration, your stress levels, how did you sleep, have you got, did you have good nutrition in the last few days? And it just gives you a score of 1 to 10, and then you sort of add up, oh, crikey, I'm really low this week on sleep and hydration and nutrition or stress levels. And it's sort of
perfect.
Like, don't go out and do that big smashing workout that you were intending to do. Just take it a little bit back. Because these sort of things, and I'm so glad you brought up that about anti-inflammatories can cause problems. Hormones are another thing, the changes in hormones, or for ladies who've been pregnant recently and things like that can also affect the actual muscle, the strength and the elasticity of the muscle. Is that right?
Yeah, absolutely. And it's so cool that you're implementing something like that, because it's what a lot of people miss. It's what a lot of people don't really see. And they're like, why am I getting all these injuries? And they learn about like managing their load, they quantify their load, they're only just ramping up slowly, but they're not realizing like there's a whole nother game when it comes to body recovery and body performance.
Exactly. We're a whole person, and we have
exactly.
Life. I think as trainers, we try to take a holistic look at the whole person's life, their stress levels, their career, their kids, their whatever's causing them. If we were all 20-year-old professional athletes who didn't have anything else to do but train all day, it'd be great, but that's not the case for 99% of us. So we have to take into account all of those sort of aspects of it when we go to do our training, and not just let it out because it's on the training plan. And we try and teach people to read your body first, then apply the training plan, and using your brain,
Perfect. Yeah. I've gone off on another tangent. I can talk about this stuff all day, but we were talking about patellofemoral pain. So yeah, one of the most common injuries when it comes to runners is patellofemoral pain. And it's almost like it's patellofemoral pain if it's pain in the knee and you can't really localize it. Like with Itb Friction Syndrome or patellotendinopathy, it's like this one point, and you can kind of, if you ask where's your pain, they get their finger and they point to one spot. Whereas patellofemoral pain, they kind of just like, it's kind of vague, and they're like, oh, I'm not too sure. It's like the top of the kneecap or around the side. I'm not too sure. And that's when you can know that it's patellofemoral pain. And it can either be, when I first started learning about this condition, when when I first became a physio, they talked about the kneecap is not tracking well enough. And so it can either, because the kneecap is just this floating bit of bone. It's literally just floating, and it's influenced by all the fascia and all the muscles attaching onto it. So if you get one muscle that's a bit weaker on one side and one that's a bit stronger or tighter on the other side, it can just drift it out of its groove a little bit. And if it's drifted out of its groove a little bit and you start running, you're going to start getting these sort of issues. You're going to start getting this sort of pain. And so that's kind of just like the layman's term, or like the layman's example of that type of syndrome. But it can also show that you can get patellofemoral pain with everything fitting really well, but just doing too much, like not being a runner and then just running for 5K. It can just irritate that joint a little bit. And so it can be a bit of a load issue rather than a weakness, tightness issue. And that's when seeing a physio can identify these sort of things, what the go might be.
So can you, two things on that one. You hear a lot of people, I started running and I got sore knees, so I realized that running wasn't for me. And that just makes me go like, oh my God, you've just missed it. Like people think at the first sign of trouble, and usually it's with the knees and that type of pain, they just think that they're not suited to running and give up, which is tragedy. And the second thing is, what are some exercises that you can do then to help that area? Is there something you can strengthen, or is it just having a good structured plan that doesn't load you too fast, too much, too soon?
Yeah. So a lot of people will say train your VMO, which is like, if you were to straighten out your leg and look at your quad, it's that really big bulgy sort of one that's on the inside of your quad. And the VMO, they say that because it has the fibers, the muscle fibers tend to have this orientation where it tends to impact, well, it connects with the kneecap on the inside. So everyone's like, oh, it controls the position of the knee, so let's just smash out the VMO. But a lot of the evidence over the last couple of years have just said just a lot of quad strengthening, just the whole entire quad complex, just trying to strengthen that up. And that's like squats, that's lunges, that's, just slow load when it comes to running, because that will strengthen your quads as well, as long as it's not a load that's producing pain. But in the like really acute stages, if someone's got it quite severe, doing some taping, some like patellofemoral taping can be really, really effective. And I see clients where I get them to, for someone who's particularly irritated, like step up on a step, and they're like, oh, that's about like a 6, 7 out of 10 pain. And then you tape them up in a certain position, like you tape their kneecap either up or across or any sort of direction, and they step back on, they're like, oh, that pain's down to like a 1 out of 10. And so if you were to tape them up and let them go about their normal day without getting that irritation, it's going to recover a lot quicker. And then when they get back into running, maybe just tape it for a couple of runs and see how it responds. I was actually taping my knee a couple of weeks ago when I started running, getting back into it, because I was getting a bit of pain. And then after the body gets used to it and there's no more pain, take the tape off and just slowly start increasing your loads. And it can be quite an effective treatment and still keep people really active, because a lot of people, when they get this pain, if they don't see a physio, they rest for 2 weeks, and then they come back and it's still there. So I'll rest for another week. And then you've done 3 weeks of nothing and get weaker, and the body's load and the body's tolerance reduces. And so they try and get back into what they were used to doing, and then that flares it up again. And it's just like this downward spiral of getting weaker, and being able to do less and less and less. Whereas we try and keep people running.
It's really hard for an athlete or a runner to know sometimes when is it the time to rest and when is it something like that's actually proactive towards getting back to normal but not dropping it. Because like you say, you stop running for 3 weeks, you're going to lose a whole lot of strength, you're going to lose a whole lot of the stuff that you've already worked for, let alone your fitness, obviously. And some things you can work around and through, and other things you really have to, And
this is when it's really, really important to, when you are injured, if you are an injured runner, it's really important to see a physio who is a runner or has worked with a lot of runners, because if someone's not a runner a physio's not a runner, they'll tell you to rest.
Yeah.
And if they haven't been trained right, and if they don't see this too often, they'll know that, well, if you do rest and then you try and get back into it, it's a lot harder. If there's something you can do to maintain some strength, if there's some sort of running you can do without flaring it up, you have to do that. You have to keep active. And I see a lot of GPs as well. Well, people come in and say they've seen a GP and they say, oh, my GP said I shouldn't run. I'm not a runner. I shouldn't run again. I'm like, that GP wasn't a runner. You know, you definitely know.
I know. It's just so tragic when you hear that, and people like they literally stop forever, and that's the end of their running career. And it's like, God, you didn't even try. You didn't push even a little bit. Let's get on to the last thing then before we have to wrap up for today. Plantar fasciitis, another thing that, and Achilles are two other major problem areas. Things that I know I've had trouble with in the past. What's your tips on those?
Yeah, cool. So they're kind of the same complex, but they have to be treated a little bit differently. You'll start to know. We'll talk about plantar fasciitis a bit because pretty characteristically, when you get this pain, it's right underneath your heel, and it's kind of you can kind of tell it's coming on with your first few steps in the morning. And a lot of people tend to ignore these symptoms, and then they just keep running and keep running and keep running. And then their steps in the morning get worse and worse and worse. And they're so much harder to manage and so much harder to get rid of. If you were just to listen to your body initially and say, oh, I'm getting a bit stiff or a bit sore. This is for a lot of injuries, a lot of tendon injuries as well. If you wake up in the morning and you're not feeling that great, and you're getting a little bit of pain here and there, and then it's happening a couple of mornings in a row, and then that sort of pain is getting a little bit worse and worse and worse. Maybe you're doing a bit too much. Maybe you're lacking in recovery. Maybe you're doing too many consecutive days. And really just recognize that and decrease your load before it becomes an issue. So with this plantar fasciitis, there's usually, characteristically, pain in the morning, pain with your first few steps, and it can be a load issue. Sometimes if someone's transitioning into like a minimalist shoe, they're doing a bit more barefoot stuff, it's just a lot more impact. And I'm a big advocate for minimalist running, minimalist shoes, but it needs to be a really slow transition because you're not decreasing load anyway, you're just shifting load. And when it comes to minimalist shoes, all that load is pretty much going away from the hips and knees and down into your calf, your Achilles, your plantar fascia, your foot. So stress fractures are like it's just shifting that load all the way down, and can, if you are strong enough, can be a more efficient run. But you're definitely leaving yourself to a lot of issues below the knee if you're not strong enough for it. So foot strengthening.
With the barefoot stuff, I think, in an ideal world, if we'd grown up barefoot, then we'd probably have feet that would cope with it. Grow up in shoes, and then you suddenly transition, and that's where the problem comes. And even suddenly transitioning to a zero drop shoe, but still cushioned, but zero drop, even that, I know for me, has caused major troubles in the past. And like, if it's not broke, don't fix it. It's sort of the approach I take with that. If you're having trouble with cushioned shoes, then you might want to try, something different. And whatever you do, you need to transition really, really slowly and carefully, and not just go bang, I'm going to run a half marathon barefoot tomorrow, or in Vibram 5-finger shoes or whatever you call it. You're asking for major trouble. So is there a couple of exercises just to wrap up? Achilles, one for the Achilles, one for the plantar fasciitis if you have got those problems. So this is one you work through. This is one that you reckon, as opposed to the patellofemoral pain, not so much. You shouldn't just work through it and keep going.
So you can still work through it. It really depends on the condition. Like, you can do some really nice taping for to support the arch. If I was to keep them running, if they're not irritable, if they have low levels of pain, you can still run. It's like, you look at their load and you say, are they doing 10Ks a day? Are they doing 5Ks a day? If there's someone who's doing, say, on average, 5Ks 3 times a week, which is pretty typical, but they're still getting Achilles pain, or still getting like plantar fasciitis, waking up in the mornings, I'll say, okay, can we just walk, run for 5K?
Yeah.
And if we just walk, run, like walk for 2 minutes, jog for 2 minutes, and just do that instead of just jogging for the whole entire time, let's see how the morning pain starts to respond. And it tends to drift down. Yep. So you're still keeping people engaged. You're still keeping them running. But then we can say, okay, let's look at maybe for the next couple of weeks, if they are a minimalist runner, can we wear a bit more of a bulky shoe and then just do some jogging and walking and see how your morning symptoms start to play out. And that can be just enough to settle down the plantar fasciitis. And once that does, okay, let's transition back into your shoes nice and slowly and then get back into it. So that's just an example of how you can keep someone still running while managing that injury. But if we're talking about like a strengthening exercise, like you're saying, a really nice one, which is kind of easy to explain, if you've got one of those TheraBands again, those elastics or stretchy bands, is you just sit, you just put your foot on the ground, you wrap that TheraBand around your big toe, and then you just pull on it and try and keep your big toe on the ground, try and keep it there. And so as you put more and more tension on that band, the arch of your foot starts to engage because it's trying to fight that resistance to the band. So make sure that that toe is nice and comfortable on the ground, and you hold that for about 10, 15 seconds, and the muscles underneath the foot start to work harder and harder and harder, without like really overly irritating anything. And if anything, you can just start with that. If you want to do some light calf raises, I like to do calf raises with slightly engaging like the toes, like you're almost trying to scrunch the toes, but just that very first part of scrunching the toes. So you're not curling them, but you're just engaging them, and engage them as you come up into a calf raise. Can really integrate a lot of the muscles within the foot, and it encourages the calf as well as all the little intrinsic foot muscles, which is what you need. You need those nice and strong when it comes to minimizing this plantar fasciitis. So just doing that TheraBand exercise and just doing those calf raises, that's pretty much all you need. And then just ramping up that load and making that exercise harder and harder and harder can get you to return back to running in those minimalist shoes, or doing that same load that you're doing without that morning pain, those morning steps. And that can be quite nice for the Achilles as well. If it's purely like an Achilles tendinopathy, you can push a little bit, and there's some really nice loading exercises you can do for your Achilles, depending on your level of irritability. But there's some really nice, like what we call eccentric, like loading up the Achilles and getting them to people to drop on a step or something. Can be really nice if it's that low level of irritability.
Look, this has been absolutely so invaluable today, Brodie. It's Brodie Sharpe. Brodie, once again, what is your website and how do people find you online and your blog and so on again?
Yes. So I do a blog once a week with all things running, and the Breakthrough Running Clinic. So my website, it's called breakthroughrunning.com.au, and you can reach out there. I do have a Facebook page, which the blog also goes to. So it's the Breakthrough Running Clinic if you want to just type that into Facebook. I do have Instagram, so it's the Breakthrough Running Clinic on Instagram. And then I guess the social medias for that clinic, and then the podcast. So it's Everyday Running Legends. You can just search that wherever you find your podcast that you're listening to.
Yeah, do that, because I was on it a couple of weeks ago. So that was
listen to that one. Listen to Lisa.
Look, you've been absolutely wonderful. Thank you, Brodie Sharpe, for being on the show today, for providing such massive value. There's some tricks and tips and stuff that I've picked up for sure, and a lot of stuff what we agreed on, which is really nice, because then, people tend to not listen to me all the time. Maybe they'll listen to you. That would be really great. You've obviously got a huge depth of knowledge, and I look forward to when you have your online things working, because your membership working, because then we'll be able to collaborate more and be able to help more people with their running and avoiding injury. That's the main thing. So thanks very much for being on the show, Brodie Sharpe. Thank you.
You're very welcome.